The government must provide sufficient personal protective equipment to healthcare workers or face the consequences. That's the warning from Democratic Nursing Organisation of South Africa President Simon Mhlongwane. It comes at a time when the country is struggling with a growing number of healthcare workers infected by COVID-19. DENOSA President Simon Mhlongwane now joins us live to discuss the latest developments. Simon, thank you so much for joining us. All of the days kind of melt into the other, but I feel like we had this conversation not too long ago in lockdown, where DENOSA again warned government that there was a crisis coming in terms of enough PPE. Government then responded at the time and said the PPE was coming, and it seemed that everything was sorted. But according to your statement, there's another wave of crisis coming. Protective gear for healthcare workers is one thing, because obviously they've worked their way through what has been supplied at the time, but more importantly, lives being put at risk, and there not being enough healthcare workers to deal with the surge in numbers of positive COVID-19 cases that we are now seeing, especially in provinces like Gauteng and the Eastern Cape.
Good morning, and thank you for having us. Greetings to the viewers. Yes, indeed, we are cautioning, and in fact, we are warning the employers to provide full PPE everywhere. We must start treating everyone as if any case that enters the hospital is COVID-19 positive, because it is proving that in areas that were not being provided with full PPE, people are turning positive. But also, we are going to face a serious problem if healthcare workers are going to be demising, because then there's going to be a serious shortage of healthcare workers, particularly nurses and doctors. But also, the countries from developed countries are going to come to us and recruit heavily afterwards, because they are serious about what they are doing. Right now, the government and including the private sector is running out of PPE in hospitals. You can go to Ngwelezane Hospital in KZ, and we get reports on a daily basis from clinics. They just have like only 9 PPEs available, and even including the test kits for COVID-19. So it shows that the supply that used to be there now is depleted.
What are you hearing from your members on the ground? They come to work in the morning or whenever their shift starts, they then realize that the PPE that is there is not sufficient for the kind of protection they need to be working with potential COVID-19 cases, or there's no PPE altogether. What are you hearing from them? What do they do in that situation?
Well, currently our members, because they are the ones who are mending the clinics and the hospitals, on a daily basis they count the number of PPEs that they have. I can tell you now, there are many clinics around Limpopo and many other provinces where the number of PPE available for COVID-19 specific is only around 9. In terms, imagine having only 9 gloves to take care of those patients. It means in that area, if you have an outbreak of more than 15 cases or more than 10 cases, then it means you cannot be able to cope at a given point. But also, I'm saying, or we are saying completely, we must change the outlook. We must have full gear PPE as if everyone is positive. Then that's the only way we can prevent the spread and the health workers becoming positive, because more often we're getting cases of people who are asymptomatic, but they turn positive. So it means those people are spreading the virus in the taxis, in the buses, but also they're spreading it as then when they enter the hospitals, whether it's just at the entrance or in a ward that is not. But also we're facing problems where those who are not working in critical areas of COVID-19 or confirmed areas of COVID-19, they get told they must not utilize full PPE, and some don't even get given the proper masks. We're saying all nurses and all doctors, all health workers must utilize, including the N95 in all areas, because it shows to us that now that the virus is spreading so fast, everyone must be treated as if they are COVID-19 positive until proven otherwise.
Now, the PPE is one thing, but we are already looking at thousands of healthcare workers who have tested positive with coronavirus, and a number have unfortunately lost their lives already. Talk to me about what impact that now has. If you've got thousands of healthcare workers testing positive, that means thousands of them have to come out of the healthcare workforce and go into self-isolation until they can recover, and hopefully many of them would be able to do so. That's putting massive impact on the ability for both hospitals as well as these field hospitals that's been prepared to be able to take care of the number of people coming in as COVID-19 patients.
Yes, indeed. If one nurse tests positive in a ward, it means the colleagues of the whole shift are also contacts, and there's a possibility that they could all be positive. And if they are positive, then it means they must go home. It means the entire shift must be replaced by another full shift. And the problem is that you may find that because with the advertisement of the COVID-19 staff members that have been employed recently, some of them do not have the experience. For example, if it happens that it's an ICU ward, they would not have the experience to take care of those patients. So now this whole thing is impacting heavily in the patient care completely, because you need to have people who are experienced in that space. That's why we're calling on for government to ensure that if there's still any nurse who's non-employed, must be employed, trained properly as of now, so that by the time we reach the peak, we have more people who are experienced, and at least they have been in that cold phase at that particular time, and they can be utilized when necessary. And it means there must be a retention strategy so that those people are not taken away in case a lot of people demises. Then it means there will be people who are going to replace them, because the other countries are not going to say we will wait until it is better. They will come and recruit from us, and heavily so. Once they do that, we are going to run short. But the long-term plan should be, we must have a training plan and an attraction plan so that we can be able to recruit more people and more cadres to come and train as nurses in the country, which must then be retained and absorbed into the system for the long-term usage within the public health and the private health care.
Thank you so much for your time. DENOSA President there, Simon Shlungwane, giving us the very latest from their point of view.